There is more to psoriatic disease than meets the eye. Psoriatic disease is a progressive, systemic inflammatory disease that presents a wide spectrum of clinical manifestations and comorbidities and substantially deteriorates patients' quality of life. Skin is only part of the story. There are visible manifestations like plaque psoriasis, scalp psoriasis, nail psoriasis, and palmoplantar psoriasis. Psoriatic disease impacts the body deeper than skin, with invisible progressive manifestations like psoriatic arthritis, spondylitis, dactylitis, and enthesitis. There are several comorbidities like obesity, arterial hypertension, diabetes, ischemic heart disease, and inflammatory bowel disease. There is diminished quality of life, decreased mobility, depression, psychosocial burden, and decreased work productivity. Psoriatic disease requires an early intervention with a complete treatment approach. The goal of psoriatic disease management is an early, complete treatment approach to holistically minimize the disease impact on patients' lives.
Psoriatic disease is more than skin deep. Now the world has come together to fight psoriatic disease in all its complexity. We are united to change the lives of millions living with psoriatic disease. In 2014, all UN nations made a unanimous commitment to tackle psoriasis and aid people living with psoriatic disease. But 7 years later, we have yet to see widespread action, and people with psoriatic disease are still suffering. That is why IFPA is spearheading a World Psoriasis Day petition. By getting involved now, you can spark action. More than promises, we demand progress. You can make a genuine impact on the lives of people living with psoriatic disease all over the world. Join our fight today. Sign the World Psoriasis Day petition to challenge your government to deliver breakthroughs in multidisciplinary care and equal access to treatment. Demand change in the perception of psoriatic disease among the medical community. Stop stigma and fight for everyone living with every kind of psoriatic disease. 1 in 3 people still believe that psoriatic disease only affects the skin, but psoriatic disease affects the whole body, from the joints to the heart to mental health. Patients must be informed about the consequences of psoriatic disease and empowered to seek support from knowledgeable doctors. This is not a cosmetic issue. It is a serious disease. On average, people see 3 different medical professionals before getting a treatment that works. Everyone with psoriatic disease deserves an affordable, safe, and effective treatment plan that embraces the whole person, not just one symptom. 4 in 5 people with psoriatic disease have faced stigma and discrimination due to their condition. We say no. Speak up for people living with psoriatic disease. This is the power of World Psoriasis Day. Together, we join forces to raise awareness and drive progress. The time to act is now. We are done waiting for change. It's time to get loud and demand a more educated world that knows what psoriatic disease is, how to combat it, and how to love people who live with psoriatic disease. Sign IFPA's World Psoriasis Day petition online at www.psoriasisday.org and join our fighting spirit.
Alright.
Hello!
Magandang gabi.
Magandang gabi sa inyong lahat, sa ating mga viewers. Mula
Yes,
Apari
hello.
hanggang Hulo.
Hello mga
Good
ka-weekenders. Yun. And
Yes.
welcome to our weekends with PsorPhil.
Welcome! Ayan. Grabe,
Yes.
pagod pa from the celebrations yesterday, Paul?
Yes, pagod. Pero nandun pa rin yung level of pagka-high, no? Dahil sa energy ng celebration natin. Kasi, di ba,
Oo, ang
sa mga nakapanood po, ang galing ng aking kasama ngayon bilang host kahapon.
Ang saya kasi ang daming naka-join. Napakadami nating kasama sa community kahapon. Sana andito
Yes.
ulit sila ngayon for this episode.
Oo nga. And bago tayo magpatuloy, pakilala muna tayo. I'm your host for tonight. I'm Paul, and with me is...
My name is Shea, and I'm Coach Paul's co-host for tonight.
Alright, welcome.
Oo, grabe, Coach Paul, it's our 125th episode. And the title
Yes,
of this
125th.
episode, yes, grabe, ang dami na, di ba? Ang title ng episode ngayon is Psoriasis in the Family. So, the official hashtag that we're using is hashtag WWP Psoriasis in the Family. Ayan. Marami tayong pag-uusapan ngayon. Magagandang kwentuhan or masayang kwentuhan at daming insights from our guest speaker about, parang paano ba mag-deal kapag meron kang kapamilya, anak, kapatid, magulang na merong psoriasis.
At saktong-sakto, Coach Chea, kasi nandito pa rin tayo sa National Psoriasis Awareness Week. And bago magtapos ang linggong ito, pag-usapan natin ang psoriasis. Paano ba natin to, kumbaga, tama ka, Coach Chea, no? Parang, paano yon kung biglang nagkaroon yung isa sa family members natin, or kunyari yung anak natin, or merong bata na nagkaroon ng psoriasis in the family, ano yung pwede nating gawin?
Oo. Paano tayo makakapag-offer ng support? Lalo na kapag bagong diagnose pa lang, di ba? Hindi natin alam parang paano ba natin either physical support or mental and moral support kailangan ng patient niya. But at the same time, baka ikaw rin, kailangan mo ng sariling support dealing with that, di ba?
Yes,
So,
tama.
that's what we will be discussing today.
Yun. And before we continue, di ba Coach Shea, napanood mo kanina yung IFPA na video? Di ba, for the
Yes,
global
ganda.
petition? So just to give everyone a background, so napasa po yung Global Psoriasis Resolution noong 2014. Tapos isa po ang Pilipinas na nagpirma po doon sa resolution na yon. Kaya kumbaga, pinupush po natin yung mga government kasi alam po natin hanggang ngayon, wala pa rin pong nangyayari. Marami po ang dapat gawin. So tulungan nyo po kami na mag-sign doon sa global petition. Hindi lang po kayo as patients, pero kahit po yung mga family members natin, friends, yayain po natin mag-sign doon sa global petition. And Coach Chea, meron din tayong version locally naman. Ano naman yung local version natin ng petition?
Meron tayong tinatawag na I Support Psoriasis Bill. It's a paper campaign, signature campaign, na makikita nyo sa www.psoriasisbill.org.ph. Talaga isinusulong natin to today or this year, ngayong season na to, because gusto natin ng maraming support, malakas na support ng government natin para mapa-approve ito. Ayan.
Tama. And para magkaroon tayo ng ingay dito sa ginagawa natin na program, meron din tayong TikTok Dance Challenge. So sa mga kabalat po namin or mga viewers, baka meron kayong mga pamangkin or mga friends na mahilig mag-TikTok, yayain nyo po na magsayaw nitong TikTok Dance Challenge. Panoorin po natin kung ano po itong pinag-uusapan namin na TikTok Challenge.
The pain away from me. You are the hero for me. You are the one who made me see. You led me out of the dark world I've been in.
Yun. So, less than ano lang to, no? Less than a minute lang na pagsayaw. And yung napanood nyo po is si LJ. Isa po siya sa mga influencers sa TikTok. So, thank you for supporting our TikTok challenge and our advocacy.
Coach Pong, alam mo ba kung ilang followers ang meron siya?
Balita ko nga eh. Maliit na bagay. Ilan ba?
Maliit na bagay. Over 1 million followers. And it's so important, no? Akala mo, sayaw lang siya, pero hindi lang siya basta sayaw. Imagine nyo if maraming tao and influencers and supporters putting our hashtag, using or tagging our accounts, nagkakaroon tayo ng awareness for the condition, for psoriatic disease. And nakaka-push tayo ng support for our I Support Psoriasis Bill. Diba? It's very important.
Oo. At saka maganda yun yung napupush natin yung awareness kasi di ba Coach Chea, karamihan sa mga taong may psoriasis, gusto na lang nila magtago kasi di ba ayaw nilang mapag-usapan, ayaw silang pandirihan or ma-judge ng mga tao sa nakakasalamuhan nila araw-araw. By sharing this awareness, pinapalaki po natin ang mundo ng mga taong may sakit na psoriasis.
Correct. Kaya join na kayo ng TikTok challenge. At saka also push this hashtag, push the videos, or gamitin nyo lang, mag-create tayo lahat ng awareness on social media, particularly on Twitter also. Meron din tayong Twitter campaign for Psoriasis Bill Now Na. Ayan.
Yun, no?
Yes, ayan, pina-flash naman pala sa screen ngayon, pero meron tayong mga hashtags, ayan, na ginagamit sa Twitter, Psoriasis Bill Now Na, Freedom from Psoriasis, Freedom for 2 million Filipinos, freedom for 2M, kasi ganyan karami, actually more than that, ang may psoriasis na Filipinos ngayon sa
Yes.
Philippines. Yes, so
kasi-
we are...
Sige.
Go ahead.
Sige, we are.
Hindi, sasabihin ko lang, we are representing this many people, and by posting about this, posting about our activities, our videos, ayan, lumalakas yung voice natin para marinig lang 2 million people na ito. Yes.
Thank you for sharing that. Kasi nga, syempre kami po sa PsorPhil, we are all doing our best para makapag-engage po with our lawmakers, with our government. Pero syempre po, kailangan po namin ang tulong ninyo. Kasi po, ang boses nyo ang dapat marinig, hindi lang po kami. Pero lahat po tayo as a whole community, the stronger the voice, the more that we will be heard.
Indeed. Amen.
At dahil
Okay,
doon,
meron-
may comment doon. Si Coach Doc Gia, thank you for watching. Go PsorPhil,
Oh.
sabi niya. Fighting!
Ay, nako, nakakatawa ng puso. Thank you for watching this episode also, Doc Gia. Alam mo, very important yung partnership din kasi with our doctors. You know, with our medical practitioners, doctors, dermas, rumas, everyone, residents. Kasi part yun eh. Lahat tayo kailangan magsama-sama para isulong ito at mapabuti ang mga, you know, our lives. Okay.
Tama.
So at
And speaking of mapabuti ang lives ng mga taong may pasyente, ng mga taong may pasyente, ng mga taong may psoriasis, meron po tayong patient rescue program. At ito po ay, kung gusto nyo pong makatulong, pwede po kayong mag-donate po ng any amount dito sa mga following accounts. So meron po tayong bank account, Paymaya, PayPal, and GCash. So, tulungan niyo po kami. And meron din po kaming token of appreciation para po sa mga magdo-donate. Meron po kaming tumbler, Weekends with PsorPhil na tumbler. So, pag meron nag-donate po kayo ng at least 1,000 pesos, makakakuha po kayo nito. And ano pa ba yung pwede nilang makuha, Coach Chea, pag nag-donate sila?
meron din, ano pa nga ba, Coach Po?
Eto,
Ayan, tama. Yung United shirts. Meron tayong black, meron tayong white.
Yes.
Sorry, guys. Oo. Kala ko kasi ubus na eh. Kasi nagpamigay tayo ng marami kahapon. So,
Oo,
meron pa
pero
pala.
meron
Meron
pa.
pang United shirts. Yes.
yes.
For a cost to lahat. Diba? Nakatulong ka na. Nagbigay ka ng 1,000. Nakatulong ka na. May tumbler ka na. May shirts ka pa. Oo.
Yes. And if you want to coordinate po yung mga donation ninyo, you can kindly text or call these numbers: 0922-808-5708, 0917-427-8297, and 0939-640-7252. So you can call or text. Just look for Ate Liza or Coach TJ on these numbers.
Correct, correct.
And
Coach Pong, meron pala tayong gustong ipakitang video. Diba?
Uy, ano to?
Yung
Baka lang hindi nyo pa
video na-
napapanood.
Yes, ito yung video na gusto nating i-share nila. And mag-comment din kayo pag napanood nyo na or ngayon nyo palang napapanood, i-comment nyo kung anong nararamdaman nyo about this video. Tapos use the hashtags that we've shown earlier.
Alright, roll VTR.
Noong nalaman nila na may psoriasis ako, sabi nila, galis yan.
Sabi nila baka nanunuraw ako. Kakalaro ko sa labas ng bahay.
Sabi nila baka may nakain lang daw ako na hindi maganda.
Sabi nila, sa hangin daw ito nakukuha. Mawawala rin daw to.
Sabi nila, gamitin mo ito. Magsabon ka nito. Uminom ka nito. Gagaling ka.
Sabi nila, Mag-sweater na lang daw ako para walang makakita.
Sabi nila, lumayo ako. Baka nakakahawa yung balat ko.
Sabi nila, hanggang dito na lang kami.
Sabi nila, wala raw akong kasama sa labang ito. Sabi ko, nandyan kayo. Panahon na para maitama lahat ng sabi-sabi. Kami naman ang pakinggan niyo.
Nakamute ka, Coach Thea.
So,
Oh, ulit. Take 2. Yan.
ilang beses ko na napanood yung video na to, pero deep pa rin. Tumatatak, talagang grabe yung emotions pa rin na nafe-feel kasi halos lahat yon narinig ko. Halos naramdaman ko and sobrang daming flashbacks. Kaya yung mga viewers natin, kung either ngayon yun lang napanood, whether ngayon yun lang napanood to or napanood yun na dati, comment nyo kung anong reaction nyo. At alam mo pong, guess kung sino yung guest natin kahapon dyan.
Balita ko na starstruck ka eh.
Ay, sobra! Hindi ako nakasalita. Imagine ako na yun, hindi nakasalita. Ang daldal ko.
At close na kayo Ate Chea.
Yes, Ate Chea. Hindi, sobrang nakaka-inspire naman kasi talaga and nakaka-blessed na nandun siya to give a message to all the viewers yesterday, all our participants yesterday. Kaya, alam mo yun, parang nakaka-overwhelm. Ganun yung na-feel ko.
And again,
Ayan.
Marami pong salamat ulit, Miss Moira De La Torre, for giving a strong voice, a strong face for our psoriasis community. Marami pong salamat. You deserve po the most inspiring person with psoriasis award. Marami pong salamat.
Yes, maraming salamat. Ayan, ano na ba? October 30, magno-November na.
Oo
In a few days. And to our viewers, kapag merong mga nagse-celebrate dyan ng mga birthdays, anniversaries, graduation, I don't know, kung meron kayong gustong i-shoutout, mga happy birthday dyan, feel free to post it on the comment section. Baka i-post natin, ipakita natin sa screen a little later on. So, yan. Happy birthday sa inyo.
Happy birthday agad. And don't forget to click, like, and share our episode tonight. And don't forget to use our official hashtag WWP Psoriasis in the Family. Importante po na ma-share po natin ngayon kasi po ito po ang pag-uusapan natin. Ano ang gagawin pag nagkaroon sa kapamilya natin na nagkaroon ng psoriasis? Ano yung mga dapat nilang gawin? So ito po ay makakatulong sa kanila. Paano po nila alagaan yung sarili nila o yung kapamilya nila? Yan.
Alam mo, hindi niyo alam kung minsan nag-share kayo, meron lang pala kayong ka-Facebook or ka-Twitter na merong gantong condition din, magtutuwa sila kasi, di ba, hindi na naman openly pinag-uusapan yun sometimes Pero dahil shinare nyo, yun, kakalat at makakatulong ka pa.
Totoo. At ako, Coach Chea, yung kwento ko, paano ako na-connect kay PsorPhil, yung friend ko, sinabi niya na, oy, may ganitong grupo, napanood ko. So, doon ko hinanap si Psoriasis Philippines, doon ko sila na-meet. Kaya wag po nating maliitin yung pag-share kasi it's very powerful and katulad ko po na merong psoriasis, binago po nito yung mundo ko. So doon sa nag-share ko na kaibigan, kay Alvin Tan, maraming salamat sa pag-share sa akin nun. So share lang po natin itong ating mga weekends with PsorPhil na usapan. Yun. Coach Chea, siguro wag na natin patagalin kasi alam ko maraming questions and excited ako sa guest speaker natin ngayon kasi balita ko tong doktor na to, yung puso niya sa mga pasyente, lagi kong naririnig. Ang bait-bait niya and ang galing niya mag-relate.
Alam mo,
balita ko, doktor mo siya.
Yes. Sasabihin ko pala lang na ako personally nakaka-relate ako sa sinabi mo and I will attest to that. Grabe ang puso nitong guest natin to. She really goes beyond. Oo, hindi siya yung typical na ano lang, na reseta lang, ganyan. Talagang, oo, yung heart niya is in helping patients. And I'm sure hindi lang yung mga may psoriasis, pati lahat ng patients. Oo.
Dahil dyan, I will let you do the honors in introducing our guest for tonight.
Sure. So, this doctor is a consultant staff in the Department of Dermatology at Makati Med and Rizal Medical Center. She is the head of the Phototherapy Center in Makati Medical Center. She is also the head of the research committee in the Photodermatology Subspecialty Core Group of the Philippine Dermatological Society. This doctor is a fellow of the Philippine Dermatological Society and is also a fellow of the Asian Academy of Dermatology and Venereology. Let us all welcome my doctor and our special guest for tonight, Dr. Patricia A. Tinio.
Thank you. Good evening. Grabe, nahiya ako. Nahiya ako. Hi, Chea.
Hello.
Welcome back.
Good to be here with you guys. Thank you for having us.
Yes.
Oh, so happy.
On behalf of Makati Med Wellness Center, di ba?
Yes. Yun,
Ayan.
Before tayo magkwentuhan about psoriasis, gusto po namin kamustahin po kayo, Doc Tricia. Kamusta po kayo during this pandemic or this past few weeks? How are you? Yung practice nyo or kahit the family life, how are you coping up?
Well, during last year's 2-month lockdown, yung talagang nag-shutdown lahat, really, I stayed home. And in a way, it was nice. Pero when we reopened after that 2 months, I started going back to clinic already. Although the hours are shortened. Kasi I think, when we were together here the last time, Pong, I was saying parang it's scary, but you can't let fear take over eh. So parang, I'm trying to be as regular, as normal as possible, but really stay safe and follow all the precautions. So I'm going to clinic. So coping, I think like all of us, we're trying to cope, right? And hoping that this will really normalize soon, our situation.
Sana. Malapit na sana.
Pero siguro po, doktora, no, parang we have to know na hindi na babalik sa dati. We'll also have to adjust to the new normal. Yung, alam mo yun, parang extra careful na tayo ngayon sa mga bagay-bagay, sa paghawak, sa pakikipag-usap, sa beso-beso. Ganyan.
Yeah, a lot will change and not be the same talaga. But we'll adapt. Yes. I'm sure we'll be okay eventually.
Yes.
Agree. All right. So, Doc, let's begin with the questions again. So,
let's begin talaga.
Yung topic po natin ngayon about having psoriasis in your family, no? Siguro, the first question I wanted to ask is, what are the chances of someone in the family, if you have psoriasis, for example, if I have psoriasis, ano pong chances na meron din yung iba na meron magkaroon ng psoriasis?
So, the research now tells us that there's really a genetic susceptibility na familial. So, pag meron sa pamilya, right now they're saying it's more than 20% chance ang mga pasyente na may relative talaga na may psoriasis. And then, parang more than 80 genes na ang na-identify na related to psoriasis. So, strong talaga yung family background. But we know it's not all that, right? There's also environmental. So the environmental triggers also play a big role.
Yes, Doc. I-clear ko lang dun, Doktora, no? Kasi, di ba, sinasabi natin genetics, namamana. And some misconceptions, minsan parang iniisip ng iba na set in stone na pag nagkaroon ako, magkakaroon na yung mga pwedeng maging future descendants mo or mga anak mo or kapamilya mo. Pero ano po ba yung nasabi nyo kanina, Doc, dapat merong external factors or trigger factors. Ano po tong mga to?
So, well, a lot of times it can be stress or any infection, especially in the younger population. It can be triggered by a bacterial infection sa throat. So like a strep throat infection. Actually, I know patients na their psoriasis was triggered by major life changes. Like naghiwala yung parents or nawala ng trabaho or sudden death. So stress really has a major role. And then it can also be like cold weather. It's also a factor. So you have the genetic predisposition. So yung tendency na magkaroon, nasa loob mo na. Tapos pag may nangyari from the external na nag-trigger sa kanya, lalabas siya, magmamanifest siya. Pero tama ka, hindi porket yung isang kapamilya mo meron, lahat na magkakaroon. Or pag ako nagkaanak, magkakaroon din yung anak ko. So hindi ganon. Sabi nga natin, around 20%, not 100%. Okay? Around 20% also have a family member who has psoriasis.
Thank you, Doktora, for clarifying that. Kasi yung iba, we have some members na parang takot magka-baby kasi parang baka mapasa doon sa anak nila. So, thank you for clarifying it, Doktora.
Marami rin ako nakikitang comments na ganyan. Nako, may psoriasis ako. Sigurado bang magkakaroon yung anak ko? So, it's good to know na hindi naman po pala. At saka, yun nga, may triggers bago lumabas yon. So, sana hindi naman.
Kasi yun din yung greatest fear nila di ba? Pag may anak na sila, tapos on the later part of their adulthood sila na diagnose ng psoriasis, yun agad yung iniisip, lalo na kung parents sila, di ba?
True.
Yes.
True. And then, of course, they'll also feel guilty, di ba? Which we don't like. And that's why the treatment for psoriasis is really holistic, di ba? We treat everything, educate.
That's Dr.
Doc, you mentioned earlier that yun nga, yung something about the age. Pwede po bang malaman kung merong particular age na you can expect people, parang statistically, kung anong age nagkakaroon ng psoriasis?
Okay, so supposedly the mean age that you'll get psoriasis is around 33. And they say that there is such a thing as an early onset and a late onset. And the cutoff is 40 years old. And then most people, around 75% will get it before 40. And I know, Chea, you got it early, right? Because, you know, as many as 40% actually start developing psoriasis symptoms before they're 16.
Okay, so very early onset pala talaga ako. I got it at 13. Yes, well, I had it at 12. After, ang trigger ko po ay dengue. It was my second dengue bout. So bout with dengue. Yes, ayan. And then, yun, lumabas na siya at 12 and then diagnosed officially at 13. Yes.
So, ako 16 years old, tingin ko, nag-start.
Aga din.
Ayun na yung mga thesis days ng college. Yung mga walang tulugan.
Uy, ang bata mo, nasa college ko na at 16? Talaga?
Yeah.
Siguro ang talino, Sir Pong.
Accelerated.
Tapos mga 18 ako na-diagnose talaga kasi lumagpas na siya sa hairline, doon lang ako nagpa-check. Kasi kala ko parang baka dandruff lang yan or something. Yeah.
So, Doc, yung mga ganito po, yung mga bata hanggang teenager, what is the management or treatment for, yung management ng psoriasis in children?
Okay, as a general statement, I'll say that it's the same as adults with some medications that are contraindicated because of their age. And one that comes to mind is Psoralen. So it's not so commonly used now, but oral Kuva That's contraindicated for less than 12 years old. But you guys know about the treatments, right? So topical steroids, pwede yan. Yung mga calcineurin inhibitors, yung mga tacrolimus, pwede rin sa bata. And then, of course, the other oral drugs like methotrexate, cyclosporin, it can be given. We usually work with a pediatrician. Now, the retinoid, yung acitretin, pero hindi siya available ngayon. You just have to watch out for like bone growth because it can stall that. And then the biologics and phototherapy pwede rin sa kids. Pero yung phototherapy, kung sobrang maliit pa sila, mahihirapan to stay in the booth mag-isa. But sometimes we allow the caregivers, the moms or their nanny to go inside the booth with them. Okay? And then for the biologics, there are biologics that are already approved for the pediatric population. So in our country, meron naman. And I know dermatologists from PDS, even if it's off-label, pag kailangan talaga ng pasyente, ibibigay nila. Whatever biologic that may not be approved yet. So basically, Shay, it's almost the same as in adults with just several medications that you can't give talaga. Or, syempre, the way you give the other medications, lower dose.
Yeah.
And then, pag sobrang baby, psoriasis can come out as young as 1 or 2 years old, right? Pag sobrang baby, you're careful with the topicals because they tend to absorb more of it. So, things like that.
Right. So, parang adjusted levels. Pero, Doktora, i-remind ko lang po though sa viewers natin ngayon na wag kayong self-medicate. It's so important that alam mo yun, maski na akala mo like meron kang kamag-anak or kaibigan na gumamit ng ganitong gamot, tapos narinig mo, nag-work sa kanila na medyo, hindi man gumaling pero nag-lessen, hindi necessarily yun dapat yung ibigay sa bata, okay? So, kasi Doc, maraming ganyang cases ngayon na parang okay to. Ganyan, makita ko sa internet.
But can I tell you guys, I'm so grateful then to PsorPhil because it has happened so many times that I see patients in the clinic and because of how you educate in PsorPhil and just the support that you give in terms of information, education, I think a lot of patients now are more knowledgeable.
Oh, so that's good.
Doktora, nabasa ko sa PsorPhil or ganyan. So, maganda yung ginagawa nyo. Yeah.
That's nice. Nakaka-encourage mo.
Yeah, we see it. I experience it. So, very effective.
Oo, kasi parang kumbaga may application talaga, no? Na-feel nyo talaga yung effect or impact. Kasi parang we're using social media to educate. Pero we encourage them to go to your doctor still for the actual medical advice. Yun.
Kasi diba, sa advocacy po natin dito sa PsorPhil, talagang number 1 priority po is the patient safety. Tama ka, Coach Chea, no? Na parang itudugtong ko siya sa video natin. Huwag tayong maniwala sa sabi-sabi. Di ba? Sasabi nila. So, makinig po tayo sa mga doctors, sa mga experts po. Kasi yung mga ibang gamot, yung iba kasi, di ba, pag nareseta sa'yo, yun na yung gagamitin, di na babalik sa doktor, which is super dangerous. Kasi yung side effect, hindi natin alam, nabibuild up na pala yung side effect. Tapos pag nag-manifest na siya, too late na to control. Kaya dapat, we always go back to our doctors.
Correct. Yung relationship na yon, di ba, Doc?
Yes, because a lot of the medications have to be monitored. Di ba? Kasi nga, itong gamutan natin is kind of long-term. So, you have to monitor your side effects regularly, like Pong said, so that you don't have the permanent na magiging problema. Kasi lahat naman ng gamot, meron yan risk, may benefit. And if you work with your doctor, that will always be balanced.
Tsaka po, di ba, ina-adjust nyo? Ayan.
Tama.
Go ahead.
Go, Coach Chea.
No, I was just gonna say, ina-adjust ninyo as doctors yung medication depending on the outcome or yung parang reaction dun sa tao. Kasi di ba iba-iba naman po ng reaction yung mga tao. So,
Correct.
importanteng babalik.
Oo,
Or
tsaka
mag-update lang.
unang-una, yung kind of treatment you will get is based on the evaluation of your doctor. So, kung ano yung tamang bibigay sa'yo base sa kondisyon ng balat mo at that point. So, hindi pwedeng kukunin mo yung reseta ng ibang tao. Diba?
Tapos,
Or
doktora,
ulit-ulitin yung nagamitin yung reseta na 2 years na yun pa rin. Okay.
oo. Kasi ano lang, siguro I just want to take this opportunity rin, Doc, to clarify. Kasi marami po kaming natatanong or nare-receive na feedback. Kasi sinasabi nga natin, walang lunas yung psoriasis habang buhay na. Ano po yung masasabi nyo na parang ayoko na bumalik sa doktor kasi wala ngang gamot eh. Parang wala namang changes. Diba? Kasi gusto namin agad-agad mag-work, mawala agad. Ano po yung masasuggest nyo doon, Doc? From a point of view nyo naman po as a physician, how do you address those concerns?
Okay, so first, just like the really good video you had at the start, it's psoriatic disease. It's not just skin. So there's stuff happening also inside, right? All the comorbidities. So it's not just gusto mong matanggal yung nakikita sa balat mo, gusto mong alagaan yung overall na kalusugan mo di ba? Because all those comorbidities are serious. So you can't just say na ayoko na lang. Because if you have good treatment, those problems, the heart, the hypertension, the heart disease, diabetes, liver problems, all of that will also be taken care of. And let's not forget the mental health, right? So you see a doctor because, eventually a treatment will work for you. And even if sabihin pa na wala pang talagang isang lunas na permanent na mawawala ito, so many new treatments now are very effective. It can really clear you up. And it can clear you up for some time. Although I admit those treatments are kind of costly, but you're working hard, right?
Yes.
PsorPhil, IFPA, you're working hard with PBS, with PRA, so that through the government or the insurance companies, pharma companies, we can really provide these medications, the ones that are very effective. Ako kasi, pag sinabi mong wala naman talagang mangyayari, babalik at babalik, parang you're giving up, which is wrong. Because definitely there's so much treatment that we can do. It will control your psoriasis. Maybe it will not go away completely, but it will be controlled and kill off the comorbidities. Yung mga ibang sakit na kailangan natin i-address at gamutin, di ba?
Yes. Agree.
100% agree. Kasi isa pa rin nga po na naalala ko dun sa kwentuhan natin kanina about yung mga kids meron na kaagad. They can have it even as kids is the importance of early detection din po, di ba, doktora?
Right.
Na parang wag niyong mamaliitin yung akala niyo, ay, ganyan, galis lang yan, allergy lang yan. Patingin niyo na kaagad. Oo. Punta na kayo kaagad sa doktor. And then to your point naman po ngayon, doktora, tungkol dun sa huwag kayong mawawalan ng pag-asa.
Yeah.
Actually, yun nga yung, di ba? Kasi over time, nagkaroon talaga ng, I've had it for a long time now. Ayoko sabihin kasi malalaman yung age ko. Pero a long time now. So, having it for a long time now, nakita ko yung improvement in research, in science, in medication. Opo. So, over time na parang ngayon, when I was diagnosed, akala ko hindi na ako makakalakad ngayon. Pero ngayon, di ba? Normal na normal pa rin yung life ko. Parang ganyan. So, and yun din yung pag-plug uli nung I support psoriasis bill. Kaya kailangan talaga tayong magsama-sama dun sa pag-support nun, di ba, doktora? Kasi yun, para mapansin tayo ng research institutions, ng government, ng iba't iba lahat na kailangan pagtuunan ng pansin ito.
Yes.
Opo.
Yun. Doktora, going back to our questions,
Yes.
since napag-usapan po natin yung kids, how about naman po in cases na pregnant si patient? When it comes to pregnancy,
Yeah.
how do you take care of these patients?
Okay, so let me say first that we're talking about pregnancy, but actually, we should include all women who are childbearing age na. Well, they don't have to be married. But, meron tayong mga kasamang doggies. Anyway, di ba? Kasi, yung may psoriasis ako, may 20s, 30s, pwede ako mabuntis. Yung mga gamot na ibibigay ng doktor ko sa akin, i-consider din yun eh. Kasi, di ba, let's face it, there are unplanned pregnancies, right? It can happen. I'm just gonna
Opo.
plug my laptop, ha?
Sige lang, Doc.
Okay, so, in terms of naman sa pregnancy na talaga, so I just wanted to make the point, but sa pregnant na talaga, definitely there are oral medications that are a no-no because they will cause birth defects in the fetus. Okay, so yun yung methotrexate at aceclifene or yung retinoids. In fact, even topical, yung mga nagtetretinoid, you really avoid that in pregnant. And then, phototherapy pwede. Pero syempre, they're kind of prone to getting pigmentation because of the hormones and then the combination with the UV. But phototherapy is one of the safer options. And then cyclosporine, if you're familiar with that, yung Neoral, that's also something that may be given case to case, pag talagang severe, that can be given. And then, of course, topical medications. But we will choose for the topical steroids, mild to moderate. And it also will depend on what part of the pregnancy, di ba? So the early part of the pregnancy, you're really more careful compared to pag fully formed na yung baby, hindi na masyado prone sa ma-affect yung organs. And then, so there's also, in terms of like other topicals, you'll shy away from mga tar or yung mga tacrolimus. Pwede yon, pero siguro small areas. So definitely biologics, the last one I'll mention, there are biologics that there's one, a TNF-alpha inhibitor, that's actually approved for pregnancy and breastfeeding kasi hindi siya nagpa-pass through ng placenta tsaka hindi siya lumalabas sa breast milk. Pero in general, yung mga lumang biologics, yung TNF-alpha inhibitors, sure ako naggano na si Chea eh. Pong, hindi ko alam kung nag-TNF ka na. Pero yun, they're supposedly pretty safe for pregnancy.
Yeah.
So yun, again, the treatment, you will decide on it. You will share the decision with the doctor and the patient. And also, siguro the care person, yung caregiver, family ng patient, diba, yung husband, ganun.
Yeah. Napakaganda po nung shinare nyo, Doc, kasi di ba yung iba nagwo-worry talaga sila, not just for themselves, pero most importantly, para doon sa ikabubuti po ng baby, na ayaw nilang magkaroon ng any mishaps or kung ano man yung maging pwedeng side effect ng medication.
Correct.
Meron po ata.
Sige.
No, go ahead, Doc.
I was just gonna say, kasi there's a percentage of pregnant women who will actually parang have good skin during their pregnancy. But there's like maybe 1/4 will flare up. And then, also after, yung postpartum, yung mga 1 year after your pregnancy, meron din talaga nag-flare up ng time na yun.
Okay. So, parang it's normal lang, Doc. Kasi baka yung iba, bigla akong nag-flare up. Di ba?
Hindi, pwede.
Okay lang.
Pwede talaga.
Kasi yung iba, in-expect, yun nga sabi ni Doc, yung iba nag-clear. So, yung iba, narinig yung ganong experience ng iba, might worry na, bakit ako hindi nag-clear tapos parang lalo pang nag-flare up, di ba? Baka kabahan naman sila.
Ang dami kasing factors eh. Di ba? Ang daming factors that come to play with psoriasis. That's why it hasn't found one treatment, diba? It hasn't found one cure. Because there's so many parts of your immune system that can be triggering it, and then the environmental things. So there's no one na experience is the same for all patients.
Correct.
Iba-iba.
Ayan, sorry po. Sorry po, nag-mute ako kasi maingay yung background ko. Pero meron po atang question sa comments. Akin yun, guys. I'm sorry. Pero may question po ata sa comment na maganda na
Okay
pwede
lang yan.
natin i-flash.
Oh.
Can
Eto.
gene therapy, actually, they're studying this now. So, di ba, psoriasis research is so high-tech. That's why the biologics were made. And now, like we said earlier, di ba, they already found more than 80 genes or around 80 genes that are really the susceptible genes that will make you have psoriasis. So now they're focusing more on, biomarkers. And then if you can remove certain genes and then you'll not get psoriasis, which of course they're in the process. So I can't answer that na sure pwede. So they're still studying it now, but that's the trend. Diba? In the same way na they know which genes will make you have breast CA. Diba? That's why they test it. And then some people opt to have their breasts removed already. Right? There are famous people who do that. So that's good.
Yes.
To know na if I have this gene, I'm going to get breast CA, mga ganun.
At least po mas informed na kayo, no? Meron ng information na pwedeng i-present sa inyo to make your decision bago pa lumabas. Pero sana po mag-improve. Opo.
Hindi, pero kung if they discover more, then they can also have treatments for that. Right? Because then the biology is evolving. Almost every how many years we get better ones. It's because of the research that comes out.
Opo.
So I hope one day that will come.
Parang part siya ng early detection pero pre-early detection pa siya. Parang way before yung diagnosis, no? Ang galing, sana nga po mag-improve yung research about that.
Eto, Doc, may question from Jane Tohong. Kasi di ba nasabi natin na there's something to do with immune system yung psoriasis.
Correct.
When boosting immune system, cure us. Yun yung word na ginamit cure.
Okay, so Jane, good question, huh? The thing is, I would say, not a cure, but control. It can definitely control. And I'm glad you brought that up because one thing I want to mention is about lifestyle, right? Diet, exercise. Because how do you boost your immune system naturally? That's basic. It's your daily activities. Are you getting enough exercise, sunshine, sleep? Are you eating healthy? Okay, is your food all like processed, instant food, junk food? Or are you eating vegetables, fruits, really healthy food? So definitely, I know patients who turned vegan, for example, and they really say that their skin is so much more controlled, their joints are not as stiff. And definitely, that for diabetes or hypertension, hyperlipidemia, the metabolic syndrome that's associated with psoriasis, lifestyle is such a major factor in treating those conditions. So yes, if you boost or make your immune system healthy, you can have definitely much better control of your psoriasis. And I tell that to all patients. Because I tell them, this is one treatment that you don't have to pay for, really. Okay? You don't have to go anywhere for it. It's what you do every day. It's just a matter of what you choose. Diba? Today, am I gonna eat instant noodle? Or am I going to have a healthy salad? Diba? Am I gonna drink soft drink? Or am I just gonna have water? Diba? Or fruit juice na fresh? Okay, am I gonna get
things, no, Doctor?
Am I going to exercise? Diba? Am I going to have 30 minutes of exercise today? Am I going to Ochea? Am I going to let my social
Tinatamaan
media by 2 hours and sleep early?
Actually, tinatamaan ako ng doktor ako. Yes, but that's true. That's true. Actually, that's so true po kasi awan ko sa'yo, Coach Pong, na-experience mo ba yun yung kapag ilang days ka na kulang sa tulog? Biglang makikita mo na rin nagfi-flare or ilang days
Yes.
nang walang, walang enough, yung parang alam mong nasi-stress ka na, biglang na feel mo na, nako, patay, nagfi-flare up
Totoo
na ako or
yan.
sumasakit-sakit na yung bones ko.
Oo. Good reminder yan, Doc, kasi di ba lagi rin nating sinasabi ng mga doctors natin, kunyari, kunyari ako, na-frustrate ako, ginagawa ko naman yung gamutan, pero walang changes.
Yes.
Pero ang nami-miss po is the lifestyle. Kumbaga, di ba po dapat, we are suggesting na aralin natin yung sarili natin, alamin ano yung mga triggers natin, para iwasan at makatulong sa ating gamutan. So, that's a very good reminder, Doktora.
Thank you po. And Ed, last, I might forget, alcohol and smoking. I mean, smoking, it triggers psoriasis, but it will also give you lung cancer and so many other bad things. Okay? And then, too much alcohol. I don't know, do you guys drink? Diba? I mean, there's healthy alcohol like red wine. Pero syempre, yung laging nag-alcohol, nag-beer, whatever, that triggers psoriasis also. So tama ka, maski nagagamot tayo, there are other factors that will make the psoriasis come out.
Yes. Yun.
Sa mga viewers natin. O yun, ako rin.
Guilty ako sa tulog.
Lalo na busy ngayong October si Coach Pong sa mga activities.
Yeah.
Pero magandang reminder yung inom kasi magpapasko na. So, ayan. Maraming parties uli. Maski online lang. Kung minsan may inuman over Zoom, di ba?
I tell patients, pagka-methotrexate, bawal. Paano yun, Pong?
Letter E eh. Had sign ng E. Inuman. E-party na ngayon, Doktora daw eh.
E-party. Zoom-mustahan.
Bawal kasi ang face-to-face.
Oo nga.
Eto, Doc, since we're talking psoriasis in the family,
Yeah.
what are some tips that you can give to family members or caregivers dun sa pag-aalaga, dun sa mga kapamilya nila na may psoriasis?
So, well, we've been saying this over and over, but I think this is really a basic. Get educated. Okay? Kunyari, ako yung asawa or yung kapatid or yung nanay, kailangan matutunan ko all about this. Yan ang number one. Kasi una, mababawasan yung takot and the uncertainty. And then it will make you feel empowered that you can control this condition. Diba? So, learn about it. Study it. Ayun, you engage with your doctor, with PsorPhil, support group, other patients. Learn everything you can. Because that's the one thing that will really help you. Not just in clearing, but mentally. The psychosocial impact of psoriasis is really great. And if we're more educated and informed about it, I think that can also be controlled. Okay, so yun ang isang napaka-importante. At syempre, as someone with a family member with psoriasis, maybe you can help reduce stress around the house. Diba? And then encourage your relative, your family to get treatment. Samahan mo. Diba? Ikaw yung, kunyari, diet and lifestyle. Ikaw yung mag-encourage na, kain tayo ng healthy, mga ganyan. Tapos, help them stay productive. As much as possible, encourage them not to be isolated, still be with people. And then, napaka-importante, keep talking, keep communicating. How are you feeling? Diba? Your emotional well-being, what are your feelings now? Tapos, you always watch out for signs na nade-depress or bigla na lang irritable or laging galit. Diba? Nag-iiba yung eating habits or hindi nakakatulog. Kasi we can't minimize or discount that effect on the patients. But of course, as someone who's like a family member, a support giver, you have to take care of yourself also, di ba? Kasi sino na yung tutulong dun sa pasyente kung ikaw mismo stress na stress? Right? So, actually, the two of you had it early. There's also issues there na, school and friends and getting bullied. Diba? So, I think if I'm a parent, my kid has psoriasis, I'll do what Cheya's mom did. Talk to the school, talk to the friends, inform them it's not contagious, stuff like that. Diba? And then, of course, like the kids, talk to other kids who have it also. Diba? And always make your relatives, your family members with psoriasis feel that you're there for them. Kasi I always say na parang having psoriasis is as serious as having a chronic disease, diba? You can make it similar to, in fact, cancer. Pero syempre, hindi mo naman ikakamatay. Pero it's like that. That's how serious it is. What do you think, guys?
Oh, I loved everything you said actually po. Kasi parang lahat applicable dun sa mga, parang naaalala ko lahat nung ginagawa ng family ko personally. Oops. Ayan. Ikaw po.
Yeah, kasi it's very important na kasi iniisip natin na patients, walang nakakaintindi sa akin eh. Kumbaga, hindi mo gets eh. Real talk, di ba, Doc? Parang hindi mo gets yung pinagdadaanan ko eh. Pero tama naman na it's important din na kami po yung sa mga nakakausap po namin na ibang patients, we also encourage them na, kunyari, yung noon pa po, yung merong pang face-to-face activities, na isama mo yung husband mo or yung parents mo para ma-meet niya rin yung community natin, makamit siya ng ibang patients, at para mas makarelate sila, ano yung pinagdadaanan. Kasi like si Cheya kanina, although off-air pa tayo nun, di ba, iniisip mo parang, yung mom ko nagwo-worry kasi hindi ko naman gets. Di ba? Yung sa akin, okay lang. Parang, okay, may sore ako, pero mas stress yung parents ko or yung family ko. Which is, yun yung nag-i-stress sa akin, not actually having psoriasis. So, yun po yung dapat na open communication within the family din.
Oh, so you experience that po?
Yes, kasi parang sa kanila, big deal. Lalo na po, syempre, nakikita nila flare-up. Naiintindihan ko naman, di ba po? Pero, kumbaga, ikaw, pwede kasing chance na you're really in pain na ayaw mo nang ipakita because alam mo yung magiging reaction. Di ba?
Yes.
So, parang you don't want them to worry, so you keep it to yourself. Marami pong ganun dito sa community natin. Yeah.
Kaya po, Doktora, sobrang nagustuhan ko yung sinabi niyo, connected ka sinabi ni Coach Pong, yung encourage niyo sila to parang still live a normal life, na parang while sinusuportahan niyo sila and nagiging patient kayo sa kanila, sinasamahan nyo dun sa mga lifestyle changes and encourage. Importante din na alam nila na maski may sakit sila, kaya pa nila to do stuff. Kaya pa nila na mag-aral, magtrabaho, yung ganyan para hindi mentally parang ano bang nangyayari sa akin, di ba? Kasi yun nga parang kuminsan gusto mong maging strong pero nakikita mo yung iba nahihirapan kasi ga-adjust sila sa'yo.
Yeah.
So, ang ganda nung sinabi niyo dun kanina, Doc. Actually, ang daming maganda kayo sinabi na wala lang ako.
Actually, lahat. Maganda yung sinabi ni Doktora. Which is,
lahat.
We super agree.
Ayan, ako, grabe. Coach Pong, Doktora, 8:56 na. Ang bilis. Ang dami ko pang gustong itanong. Pero yun nga, ano po ba yung important, parang let's emphasize siguro po, how can you emphasize the importance of yung sa caregivers being, I think you mentioned it na rin po kanina, no, yung being strong Na
Oo.
hindi lang nila iniisip yung pasyente, pati sila rin mismo eh.
Correct.
Importante.
Oo.
Or parang doktora, syempre there's also a burden for the family members. Kasi di ba, pag may
Definitely.
psoriasis sa isang family, or kahit anong sakit,
Tama.
everyone is affected. Pero meron po ba kayo masasuggest, Doc, when it comes to the family members and caregivers na how can they balance over worry, over stress, over protectiveness? How can they balance? Ang hirap ng tanong ko, doktora, sorry. Na-put on the spot ko yata kayo.
Hindi, pero totoo yun eh. Mahirap talaga. You know, after everything I said in terms of yung educating, get educated, di ba? I think you need to really build a relationship kasi with your son or your spouse na nag-uusap talaga kayo lagi. You really say how you feel, what's bothering you, what's stressing you out. Because like you, Pong, kung sinasabi mo, alam mo, mas nasistress po ako pag nakikita ko na ganyan kayo. If you open up, I think communication aside from all those other things. Kasi, therapy can help, ha? Maybe in our country, there's still a stigma, but definitely family therapy. Don't discount that. With a psychologist, when you feel na nahihirapan na, yung isang kapatid, hindi na nagbibigyan ng attention kasi yung kapatid na may psoriasis, siya yung laging pinapansin. Yung may ganon, ma-affect din siyempre yung relationship ng mga magkakapatid. So, get help. Therapy will help. But I always say, aside from knowing about the condition, you talk to each other, your family. Okay? Know who else? Who else will be supporting you? It's the family. So, just be open. Keep talking about your emotions. And I think eventually, of course, pray. You pray together as a family. When you're praying, that's when you can talk about tulungan kami with what we're going through and stuff like that. I think there's nothing that you can't overcome if as a family, especially, or if you're a very good friend to someone who's having a hard time with psoriasis, you really make them feel that you're there. By talking to them, by checking up on them. Right now, it's hard to be physically with friends, diba? Family, hindi.
Yeah, pero sila lang kasama mo ngayon.
Yun na nga. So, dapat na nga, mas lalong nag-uusap kayo. Diba? Wala nang choice. Kasi that can be negative, diba? You get so much of each other na kainis. You can make it work for you Now, you have all this time, you're forced to be together, start talking. Diba?
Tama.
Totoo. Importance of communication. Sobrang important talaga yung open communication, no po. Kung minsan, akala nyo, parang may iniisip kayo, pinapangunahan nyo na sila kasi hindi kayo nag-uusap So, yung pala, they're doing it for you lang rin naman pala. Doc, ang dami po nating magagandang comments. Ayan. Pina-flash natin sa screen ngayon. And we also want to say hi to the doctors, to other doctors who are listening and watching us right now.
Dr. June Pascual is watching. Hi, Doc June.
Wow! Hi, Doc June. I want to say hi to Doc Nina.
Hi, Doc Nina.
Kung nanonood ka, hindi ako sure.
Si Miss Ann din nanonood Hi, Miss Ann.
Si Doc June andito Hi, Doc June. Oh, si Sir Don. Hi, Sir Don.
Ang dami.
RMC.
Ang dami yung fans.
Head nurse din. Si Sir Don, head nurse namin sa RMC. And of course, Doc Gia.
Ay, eto. Starstruck ako naman dyan, no?
O, diba? Starstruck kay Doc Gia
Si Carl. Naalala niyo pa si Carl, Doc?
Oh. Kumusta na si Carl? Oy, saka mag-hi ako dun sa mga nurses, saka si Janine, yung manager sa Makati Med. And all our nurses there are staff. And Dr. Elsie, I don't know if she's watching, the chair of dermatology in Makati Med.
Hello, thank you for watching, guys.
Thank you.
Thank you, guys.
Ayun.
Biten,
Pero
no?
Doc,
Biten.
Opo, baka meron pa po kayong mga final tips and reminders to our audience about yung either sa patient or sa mga caregivers. Yes, nila.
Siguro
Carers.
the most important, Che, is patients with psoriasis now, you should never lose hope. Because in fact, with all the recent treatments, you can really be in remission. You can be clear. So the worst that you can do is give up on it. Okay? You have so much support all over the world. In the Philippines, PsorPhil is so strong. And then you have PDS-PRA and all the doctors there. Okay? So, yeah, don't lose hope. Psoriasis is not something that you have to suffer from. Okay?
Ganda nun.
Kasi,
Oo, sobra. I love that. What a great final message. Pero baka meron din po kayo, Doktora, gustong i-promote na mga events or mga activities.
Yeah, meron tayo dito.
From from Doc Gia, meron yata, Che.
Go, direct.
Ayun.
So, there's an event, Skin Wellness, brought to you by Makati Med Wellness Center with Doc Gia and Dr. Julie. Wow. So, November 4, nood po kayo, 12 noon to 1 p.m.
This Thursday na yan, guys, 12 noon to 1 p.m. and it's online. Kaya pwede kayo talaga manood. Habang lunch break.
So, this is on Instagram Live. Kung tama ba? IG Live. Instagram Live.
Yes, IG Live.
So, search for Makati Medical Center Wellness Center. Yan.
Meron pa ata, ayan.
Yan. Kasi kung natatanong nyo po, bakit po natin pinapakita tong Makati Wellness Center? Kasi meron din po silang mga services that can help our psoriasis treatment. So, isa po dito is yung phototherapy. Doktora, no, kung di po ako nagkakamali, meron po?
Correct po. Saka lahat ng ibang services dito, if you need to be worked up for comorbidities, meron din.
So, kasi di ba po, sabi nyo kanina, Doc, hindi lang balat ang about psoriasis, pero there's something going on and we need a holistic approach. So, with Makati Medical Center, it's a good place para maalagaan tayo if you want.
Yes.
Doc, meron atang questions yung mga dogs namin. Baka meron din po kayong gustong i-promote na ang tawag dito, social media?
Wala. Hi, Tommy. Nandito rin si...
Oy, Doc Jojo!
Oh my gosh!
Wow.
Hi, Doc Jo!
Grabe, ang dami niyong supporters, Doktora.
Sige talaga.
Ganda rin ang message
na doctors.
Don't lose hope. Pray, pray, pray. Very important. Ulit-ulitin natin yan.
Jojo is your champion,
Yes, sobra. We are very thankful to the leadership of Doc Jojo. And of course, to Philippine Dermatological Society, ang dami po naming na-meet na mababait at sobra yung puso nila para sa mga patients. We are very thankful. Kaya, oo nga po. Yun, so, huling panawagan, support po the psoriasis bill. You can visit www.psoriasisbill.org.ph para malaman po natin how to help. Yon. And isa na po doon, meron po tayo doon signature campaign, please sign. At the more po na pumirma nun, mas lalakas po ang ating boses at para po maging available at masuportahan ng gobyerno natin ang pagbili at pag-provide ng mga gamot, lalo na yung mga biologics. Kasi tama kayo, Doc Tinio, no? Doc Tricia, kasi na ang dami-daming bago na medications and very effective. Pero yun nga, it's about having the access. Eto, basahin ko lang. Sige, Doc.
Hindi, sabihin ko lang, hindi naman natin sinasabi na biologics lang ang maganda.
Yes.
Because even phototherapy, methotrexate, all those other treatments in combination can also clear you up. Diba? Diba, Pong?
Tama po yan. Kaya, again, final reminder, always have a good communication with your doctors. wag po tayong magsawa bumalik kasi napaka-importante po yun. Since panghabang buhay po yung gamutan natin, the more po na mas nakakausap natin yung doctors po natin, mas magiging kampante tayo to say, di ba, whatever in our mind or, di ba, kumbaga, sana ma-break din po yung barrier na patient ako doctor siya. Pero let's concentrate it na more on this is a two-way relationship. Kasi po, kung tayo na frustrate na hindi nagiging okay, let me tell you po, yung mga doctors din po natin, ganun din po yung nafe-feel nila. So, talk to our doctors talaga and build that good relationship with them. Yan.
Nice song. What happened to Chea?
Baka po nawala ng internet. Kaya siya nawala.
Ang daming challenges nitong technical challenges po at saka audio challenges. But no, I really enjoyed chatting with you today, Doc. Ang dami niyo pong very good reminders na parang maski nga matagal na kaming, ako personally na patient, ang tagal na may psoriasis, yung mga sinabi nyo, it's so good to be reminded of this. At saka, ako takeaway ko rin, parang naging thankful din ako sa family ko na sobrang naging supportive sila. Kasi yung mga sinabi nyo nga po, di ba, parang it's so important. Kaya yung mga viewers natin dyan, huwag kayong mawawalan talaga ng lakas ng loob. At saka ng, be thankful for what you have and your friends and family. So thank you, Doctora, for all the insights and this, very beautiful.
Thank you, Doctora Patricia. Sana po sa uulitin.
Yes.
Yun. And nakita ko lang kanina, maraming nagka-question kasi especially yung anak nila daw may sore. Just to plug, meron po kaming Caravan of Hope sa mga schools. So if you want us to help you explain sa school about psoriasis, open po kami doon. Just message our fan page. And kanina yung mga tanong about diet, meron po tayong episode for psoriasis and anti-inflammatory diet. I-search nyo lang po siya sa aming Facebook and YouTube channel. So again, Doktora, marami pong salamat. Marami po kaming natutunan about psoriasis.
Nag-hi ako kay Leo. Hi, Leo. Thank you, guys. Thank you. This was really nice.
Yun. Tapos, of course, we would also like to thank our sponsors for tonight. So, thank you po, Novartis Philippines and to Customize PH. Yun.
Yeah. Si Novartis, parati nilang sinisponsoran ng ating mga events and WWP, so thank you.
Yes. And syempre, meron pa po tayong Weekends with PsorPhil bukas. Wag niyo pong kalimutan na samahan po kami ulit bukas, 8 p.m. ng gabi. Same time, same place. And we are also simultaneously live again in Facebook. So search nyo lang po yung Psoriasis Philippines. Lahat po ng mga activities namin and updates, pinopost po namin dyan. And of course, Chea, saan pa tayo pwedeng mapanood?
You can also check out our YouTube channel. Simply search PsorPhil. Yan, PsorPhil channel. Don't forget to click subscribe, yung subscribe button, and hit the notification bell. So every time po meron tayong new episodes, nakikita nyo rin siya. Yan. Tapos I think soon, nasa TikTok na rin tayo. Kaya follow nyo rin kami doon and mag-join kayo ng challenge.
Yeah. Ayun. So again, marami pong salamat sa pagsama sa amin, sa pagtambay sa ating Weekends with PsorPhil. Sana po marami po kayong natutunan. And before we end, let me call po our tech team to join us on this virtual stage.
Ayan. Ito po, ang kasama natin behind the scenes.
Thank you.
Thank you so much.
And balita ko, may birthday tayong babatiin. Sino ito? Pa-shoutout po sa asawa ko, birthday niya kahapon, Reynaldo Rodelas. Happy birthday, Sir Reynaldo. Maligayang bati. Yan.
Meron pa bang mga gusto magpa-shoutout dyan para ipa-flash natin?
Alright. So
Again.
sayang, no? Sobrang bitin. Pero hopefully we can again have and invite Dr. Patricia Tinio sa ating Weekends with PsorPhil. Happy birthday, Coach Nida! From
Wow,
Circle
happy
29.
birthday!
Maligayang bati sa'yo, Coach Nida. Yan. And again po, sa lahat po ng nanood, sa mga members po natin, sa mga kabalat, sa mga supporters po natin na doctors, nurses, even hospitals, diba? Doon pa lang ramdam na ramdam nyo guys na hindi tayo nag-iisa, maraming sumusuporta sa atin, marami tayong kasangga. So wag po tayo mawawalan ng pag-asa, patuloy lang, laban lang, at yon from Coach Ann, pa-shoutout to me and my daughter Jasmine who are watching from Cebu. Hello. Then to John Red, pa-shoutout sa mga dogs, Coach Chea.
Makakarating.
Yan. Alright, so again, marami pong salamat. Good night and see you again po tomorrow in our Weekends with PsorPhil. Thank you po, Doc Tinio.
Thank you, Dr. Thank you to all our viewers. Watch us again tomorrow.